Well, Thames Valley has a very wide range of psychiatric placements in a lot of different centres, from Reading, Oxford, Milton Keynes, Buckinghamshire. Not just in general adult psychiatry, but in the range of specialities, for example, child and adolescent, and there's an inpatient unit in Oxford, where there are very few inpatient units in the country. There's an eating disorder service, and a very highly developed forensic psychiatry service at Littlemore. There are opportunities to work in psychotherapy. In particular, there's a day patient group psychotherapy service called the Complex Needs Service that works with people with personality disorder. That's in Oxfordshire and in Buckinghamshire. And there are services looking at the early onset of schizophrenia, early intervention services, which are established throughout the region. There's good supervision and training, an educational programme operated by the University of Oxford, MRC Psych training, which I teach myself in, and good opportunities for audit and psychotherapy training. I think most psychiatrists need to have very good people skills. They need to be able to establish a therapeutic alliance with people who may be very reluctant or frightened to engage with psychiatrists. We also have to remember that we're doctors and scientists, and that we need to formulate people's problems in a way that takes account of the medical and biological factors, as well as looking into social and psychological factors. We also need to be very good team workers, as most of our work is in conjunction with other professionals. The key things to bear in mind about psychiatry is it differs from a lot of the other medical specialities, as it focuses on history taking. I think you have to be a good listener, you have to develop good history-taking skills, good interview skills. You have to be a good team worker. A lot of the work you do in psychiatry is with other mental health professionals, with carers, and with also other organisations. So you're often working together with people, and to be able to listen to them, take on their points of view, and to hand over things between yourself and other professionals is extremely important. As well as the team working skills, it's necessary to work in a systematic framework for formulating people's problems, to be able to diagnose, to differentially diagnose and test out those hypotheses and match a treatment plan accordingly. In psychiatry, we have the biopsychosocial model, which is a framework of understanding people's mental health problems by taking into account biological factors, psychological factors and social factors. And it's important to be able to understand somebody's illness in those terms. If those aspects of the illness are missed, then the treatment may be suboptimal. Trainees may be concerned that by going into psychiatry they work with people who are not likely to get better. I think this is probably arrived at as because people's experience in psychiatry may be largely with inpatient work. So people with inpatients in every area of medicine are likely to be the people with the most severe problems, and they may be likely to be the least likely to get better. You need to remember that most people with mental health problems are actually not in hospital or even not in contact with secondary psychiatric services, but in general practice, so people have a much better prognosis than might be expected. The other point worthy of interest is that there's been a recent study of series of systematic reviews that has shown that psychotropic drugs for a variety of mental health conditions are just as effective as drugs for physical conditions such as hypertension, epilepsy and various infections. So I think I can say with confidence that our treatments work and are highly effective. In particular, treatments, for example, for the maintenance treatment of schizophrenia with antipsychotic medication and the treatment of ADHD in children are amongst the most highly effective in medicine. Some people fear they might become isolated working in psychiatry, but I would argue that it's probably the converse. Multidisciplinary working is the norm. It's very unusual to actually see a patient on your own as a psychiatrist. In the outpatient setting, the care coordinator, who's usually a social worker or a mental health nurse, will be present with you and the patient, who will know the patient better than you, so will be able to help you and to work with you to help the treatment plan be put into action. In the inpatient setting, there's a multidisciplinary review including other mental health professionals, but also trainee doctors. And consultants themselves form CPD groups and supervision groups where they will share ideas about their practice. So isolation isn't a problem. We learn from each other and we make our practice aligned with other people's practice by sharing ideas. Well, the new career opportunities in psychiatry are mirroring the changes in the service provision in the area as a whole. So the career jobs are going to be more specialised. For example, inpatient psychiatry, there's going to be personality disorder services where people have expertise in psychotherapy. And there's an expanding field in forensic psychiatry due to the need to divert mentally disordered offenders away from the criminal justice system. There are other exciting areas such as early intervention in psychosis where people with schizophrenia between the ages of 18 and 30 are worked with by specialist teams to try and prevent some of the disability that may be generated by the illness. With regard to the proportion of trainees who end up in particular specialities, probably about 45% end up working as general adult psychiatrists, although, as I said earlier, that can be a variety of different jobs depending on whether you're working in the community or with inpatients. The next two most common specialities are the other extremes of life other than working age, child and adolescent and old age psychiatry, which have roughly about 15% of consultant posts. There are much less common specialities, for example, perinatal psychiatry, which has only a few consultants in the country. Forensic psychiatry is expanding. That has quite a large number, particularly in the Oxford area. But there are other areas such as addictions, liaison psychiatry, and psychotherapy. Part-time and flexible working as a consultant in psychiatry is very favourable. The survey that I quoted before about the numbers of people who are in particular specialities found that about 25% of consultant posts were occupied by part-time or flexible people. So there's quite a good opportunity. It's also possible when you're applying for a consultant post to ask for that post to be considered for part-time working. When talking about the pathways of trainees into psychiatry, people will sometimes change careers into psychiatry at a later stage. I would very much encourage this because people coming into the speciality at this stage will have experience in other areas of medicine that can very much add to their skills in mental health working. Trainees who've come to work with me from other specialities, one from general practice and one even from surgery, and I've found that they've brought their skills with them in a way that has been very helpful to developing their careers further from then.